Chiropractic and immunity, a crossroads. Certainly magnified by our current COVID crisis is the hope by chiropractors that what they do decreases the risk of COVID infection. A belief, and the evidence for that belief is what we will discuss. A recent publication reviewing this evidence by world-renowned chiropractic researcher Dr. Heidi Haavik will be used to inform this discussion. Dr. Haavik and her team study manipulation and its effects on the central nervous system. Chiropractors often believe that chiropractic care has the potential to influence and improve immune function because this is what they observe in practice, an apparent improvement in immune function in their patients. This is informed by patient testimonials of how they're noticing that they either get colds less frequently or when they get a cold or the flu, they recover more quickly. The automatic assumption by some chiropractors is that it is the chiropractic care that is the cause of that improvement. But let's look at an analogy and then return to that assumption. Consider this scenario. You buy a new car and notice that as you drive around, there seem to be quite a lot of the same brand, model, and color. Your observation leads to the assumption that more are being sold. And beyond that, you believe that the reason is you. Because either people saw your car and liked it, or people who know you respect your choices, so purchase the same car. Well, two possibilities regarding more people buying the same car. This is correct, or it's not. Could it be checked against data? Sure. A search of sales could determine in your area how many were purchased before and after you purchased your car. Well, let's say the observation is correct. More cars are being sold. Well, now you assume that you're the reason. Can that be checked by data? Well, scientifically, it has potential. A survey could be sent out to those who purchased the same car, asking about the reasons why, and you could ask your friends. But in the absence of that data, you could continue to believe your impact on car sales unchallenged. Other than you, though, most people would consider your assumption egotistical and flawed, requiring some kind of data to confirm it, not assume it to be true without that data. So the rationale is that because there is a time relationship to your observation and that it's personally connected to you, the thought process is funneled through connecting observations of association, but interpreting them as cause and effect. When you focus on connections, you'll find them. Then you hypothesize about why they are connected. But this is potentially 2 degrees of separation from what is actually true. Let's now bring the discussion around to your patients. You believe patients have a boost in their immune response because they tell you so. Well, 2 possibilities: it's true and it isn't. You assume, though, that it's what you've done to the patient that has caused this improvement. Again, it's true or it isn't. The assumption by your patients of improved immune response is highly biased. Could it be that because they are focused on their health, that perhaps they're eating better, exercising, taking vitamin D, in addition to manipulation? And you're acutely focused on improvements conveyed by your patients. Problem is, you have no comparison. You're treating all your patients, so we don't know what would happen for those who are not being treated. If there is less infection, could that be a variation in immune response, natural history of improvement over time, seasonal changes? Maybe the kids moved out of the house and there's less exposure. And maybe because of COVID, wearing a mask more often decreases their exposure and risk. So how do you cross-check with real data? You would have to find a study or studies that do one of the following. Participants in a study without the disease are randomized into 2 groups: those treated with real chiropractic and those treated with a sham or other treatment. Over time, note how many in each group were infected, and also note that it's not about how many showed symptoms or not. It's about how it's demonstrated serologically whether there's infection or an antibody response to that infection. That's the comparison you can't do in practice. Better yet, randomize into 2 groups and infect one with a real virus and the other with a placebo virus. Yes, this has been done with one of the agents that cause the common cold. Now, to confirm further in each of these groups, treat half who are randomized to real and the other to sham chiropractic care. This is doable and would finally answer at least the beginning of the question clinically. Does chiropractic care actually help more individuals than those not receiving chiropractic care? But without these comparison groups, you simply don't know. So prior to reviewing the current Haavik article, let's review what has been published so far. First is this publication published by the World Chiropractic Association. The Effect of Spinal Adjustment or Manipulation on Immunity and the Immune System, a rapid review of relevant literature. Their conclusion was that there was no credible scientific evidence that spinal adjustments or manipulations have any clinically relevant effect on the immune system. Available studies had small sample sizes and a lack of symptomatic subjects. And also published in JAMA in 2021 was Assessment of Studies Evaluating Spinal Manipulative Therapy and Infectious Disease and Immune System Outcomes, a systematic review. Their conclusions were these findings suggest that given the limitations of the evidence, claims that spinal manipulative therapy is associated with changes in the immune system are premature and further clinical studies should be completed. And now to the Haavik article. The potential mechanisms of high-velocity, low-amplitude controlled vertebral thrusts on neuroimmune function, a narrative review. In summary, quote, however, it is not yet known whether high-velocity, low-amplitude controlled vertebral thrusts have a clinically relevant impact on immunity. Further research is needed to explore the clinical impact of high-velocity, low-amplitude controlled vertebral thrusts on immune function, unquote. They go on to state, most of the studies included in this review evaluated the immune mediators immediately pre- and post-HVLA controlled vertebral thrusts, or a few hours later on the same day. Therefore, it is not known for how long these changes in levels of immune mediators last. And further, the studies did not evaluate what these changes mean in patient populations in the long term, or whether the changes are clinically relevant. Therefore, although the current basic science research on the topic is positive, one needs to be cautious about making any claims on the use of HVLA-controlled vertebral thrusts to enhance a patient's immunity because no high-quality clinical trials have been performed to assess this important question, unquote. They go on. Therefore, the whole picture is far from clear at this stage. Whether changes in the immune mediators observed after HVLA-controlled vertebral thrusts enhances immune function, reduces inflammation, promotes recovery, or suppresses stress-associated immune disorders in symptomatic individuals is not yet known. Chiropractors and other manual therapists should be aware that clinically relevant research has not yet been done that shows that HVLA-controlled vertebral thrusts enhance immune function. This is important for all manual therapists to know when promoting the potential benefits of HVLA-controlled vertebral thrusts or when sharing information related to HVLA-controlled vertebral thrusts and immunity or the COVID-19 pandemic, unquote.